pelvic inflammatory disease. It is an infection of the female reproductive organs. It usually occurs when sexually transmitted bacteria spread from the vagina to the womb, fallopian tubes, or ovaries. How it spreads? By having unprotected vaginal, anal, or oral sex. The signs and symptoms of pelvic inflammatory disease can be subtle or mild. Some women don't experience signs or symptoms. As a result, you might not realize you have it until you have trouble getting pregnant or develop chronic pelvic pain. But when the signs and symptoms of pelvic inflammatory disease are present, you might get pain ranging from mild to severe in your lower abdomen and pelvis. Abnormal or heavy vaginal discharge that may have an unpleasant odor. Abnormal uterine bleeding, especially during or after intercourse or between menstrual cycles. Pain during intercourse, fever sometimes with chills, painful, frequent, or difficult urination. When to see a doctor? Backaches, severe pain in your lower abdomen, nausea and vomiting, fever, smelly vaginal discharge, among others. The causes. Many types of bacteria can cause chlamydia infections that are most common. These bacteria are usually acquired during unprotected sex, and sometimes bacteria can enter your reproductive tract anytime your normal bacteria created by the cervix is disturbed. This can happen during menstruation and after birth, miscarriage or abortion, or any medical procedure that involves inserting instruments into the uterus. The risk factors. A number of factors might increase your risk of pelvic inflammatory disease. Being a sexually active woman younger than 25 years old, having multiple sexual partners, being in a sexual relationship with a person who has more than one sex partner, having unprotected sex, douching regularly, which upsets the balance of good versus harmful bacteria in the vagina. There is a small increased risk of pelvic inflammatory disease after the insertion of an IDU. The risk is generally confined to the first 3 weeks after insertion. Complication of pelvic inflammatory disease. Untreated pelvic inflammatory disease might cause scar tissue and pockets of infected fluid to develop into the reproductive tract. This can cause permanent damage to the reproductive organs. Ectopic pregnancy, infertility, chronic pelvic pain, tubo-ovarian obesis, which is a collection of pus that forms in your reproductive tract. This can affect the fallopian tubes and ovaries, but can also develop in the uterus or in other pelvic organs. If left untreated, you could develop a life-threatening infection. The prevention. To reduce your risk of pelvic inflammatory disease, practice safe sex, talk to your doctor about contraception, get tested, request your partner to be tested. Don't douche because it upsets the balance of bacteria in your vagina. At Healing Garden, we offer therapies that strengthen and tone the body's system. Our herbal remedies help to completely treat the pelvic inflammatory disease.